Good afternoon, everybody. The three of us were literally in a health meeting just over an hour and a half ago to be advised that we have a case of community transmission in New South Wales. The gentleman is in his 50s, very active in the inner east. But can I firstly thank him for using his QR codes. So Dr. Chant, in giving her medical update, will be able to announce a number of venues where he frequented during the time that we believe at this stage that he was infectious. I want to stress that health is undertaking genomic testing in relation to strains that exist in our quarantine system, but also the strains that exist in the other states, as he may have undertaken some travel during that time or been exposed to people in other states. So that genomic testing will give us some indication as to the strain and therefore some potential links. But at this stage, given it only occurred we were advised only in the last couple of hours, we don't have any information more than that. But can I thank the 13,500 people that came forward for testing yesterday? We need to make sure that everybody with the mildest of symptoms gets tested. I want to thank this gentleman who came forward and got tested. And obviously he and his direct contacts and close contacts are now either have been tested or in isolation or both. And it's really important for us to appreciate that whereas we've done very well to date, we are in a pandemic, and at any stage we could have a case of community transmission. Our job now is to get on top of it, to identify any other potential cases, to identify the source and make sure that we get on top of this case. Can I please again stress that there are a number of venues which Minister Hazzard will reiterate available for testing, and in the past when we had a case in this part of New South Wales and this part of Sydney, the public were amazing in coming forward and getting tested. We really need that to happen, and we really need everybody to look up the health website for the venues. We have a number of venues already that he used his check-in in, and actually we know that he was present in the times, but we also know that there could be other venues added onto that list as people trace back their history, their contacts and where they've been. So this person did everything right, but it goes to show that we can't take a single thing for granted. It goes to show we have to maintain our social distancing. We have to make sure we have good hand hygiene. We need to get tested with the mildest of symptoms, and very importantly and significantly, we need to use the QR codes. Because this gentleman was very good at using the QR codes, we have good information on where he was and when. And the list is growing obviously, but we'll be able to update the community on what is available so far. And can I also stress that this is another good reason why people who are asked to get the vaccine come forward and get vaccinated. The more of our population that's vaccinated, the less chance we have of having people acquire the disease and end up in hospital. And that's why it's really important, an important reminder that in addition to preventing the spread of the virus, that we also encourage as many people as possible who are eligible to get the vaccine to come forward and get it. So I'll now ask Dr. Chant to give her update. Minister Hazzard will make a few remarks and then we'll answer any of your questions.
Thank you, Premier. So we've been notified of a gentleman in his 50s from southeastern Sydney of a positive result this morning. The testing was undertaken in the private by a private pathology provider, and the gentleman presented for testing on Tuesday the 4th of May and returned a positive result today on Wednesday the 5th of May. Urgent genome sequencing is being undertaken. We believe that obviously the complete genome sequence will take 24 hours, but we are anticipating that in the early hours of the morning we'll probably get some additional information which might provide us some intermediate information on the potential source. Obviously we're keeping an open mind at this time, and obviously we are looking at whether there's any match to any known returning travellers through our quarantine system, but also the genomes of any outbreaks that have occurred in other states and territories. The close contacts of the case are being urgently contacted, tested and isolating. At this current time, we do not believe that he was infectious when he went to his workplace. So at that point, we're not nominating that workplace, but we understand the workplace has been contacted. In addition, there's a number of venues, and at the moment we want everyone to be isolating and getting a test, and as we work through the usual process, we ask everyone to remain in isolation until we've done that risk assessment of those venues, but please get a test. The first one is Bondi Junction, and it's the Event Cinema in Bondi Junction on Westfield, Bondi Junction. He attended a film, The Courier, on Friday the 30th of April from about 6 p.m. to 8 p.m. But we're urging anyone who was in that cinema complex to please get tested, because there may have been, at the moment we're obviously re-interviewing him, but clearly it's difficult in those settings to understand who you might have passed by or had contact with. What's a little bit disappointing at this stage is that we've only had 100 people sign in through the QR codes for Bondi Junction. So can I urge anyone who knows anyone who went to the Bondi Junction event cinemas at that time to actually reach out to them and alert them if they haven't seen this in the media. In the Rushcutters Bay, we've got the Figo restaurant, F-I-G-O restaurant, and it's 356 to 60A Bayswater Road, and it's Friday the 30th of April between 8:45 p.m. and 11 p.m. We've got Silverwater, Joe's Barbecues and Heating, 142 Silverwater Road, on Saturday the 1st of May from 1 p.m. to 1:45 p.m. Silverwater Tucker's Barbecue at 138 Silverwater Road on Saturday the 1st of May between 1 p.m. and 1:45 p.m. Annandale Barbecues Galore at 212 to 220 Parramatta Road on Saturday the 1st of May between 2 to 3 p.m. and Casula Barbecues Galore The Crossroads, Unit 12B, Parkers Farm Place, from 4 to 5 p.m. Saturday the 1st of May. Mascot, a BP at Mascot on 1077 Botany Road on Saturday the 1st of May between 4:30 and 5 p.m. and Bondi Junction at the Meat Store between 262 Oxford Street on Sunday the 2nd of May between 3 to 4 p.m. We have been, the public health units have been asked to reach out to the owners of these premises to alert them to the fact that we're announcing them, that an infectious case was present. Can I apologise if we have not managed to do so, but given the urgency of us getting a handle on this, we have released this information. In addition, we will be updating this list as those interviews continue. Obviously, we're most concerned about household members, and so that will give me a key idea of who this person, whether this person has managed to transmit it, and also understanding the source will be really very important in understanding how many cycles of transmission we may have seen in the community that we have not recognised at this stage. So on that point, it is really critical that everyone who has got signs and symptoms compatible with COVID, please go and get a test, no matter how mild. It is critical, and the actions of this gentleman in coming forward for testing highlights the importance, and I'm very grateful for those actions. I also want to highlight that our public health actions, such as the need to isolate and need to get tested, are not changed if you happen to have been vaccinated. So regardless of your vaccination status, you need to follow that advice. Whilst the vaccine protects against severe illness, we know that people that are vaccinated can acquire the infection, and also while we understand it reduces their ability to pass it on, it's not a foolproof protection.
Thanks, Kerry. Look, I just want to indicate that obviously this gentleman now becoming positive is a very clear reminder to the community just how important it is that if you have any symptoms at all, you get tested. Or if you've been to these particular venues of concern, you should be absolutely on high alert to get tested. I want to reiterate the fact that if you've had your first dose, or even if you've had 2 doses of vaccine, and you're in the eastern suburbs, or you've been to any of these venues of concern, you're still required to go and get tested. You must be tested, because that's the only way that we can actually manage this 1 in 100 year pandemic. It's worked very well. I am concerned that up to date it's worked very well, but I am concerned that some who have had the vaccine may think that that's the end of it. Well, it's not the end of it. You may still get the virus, as Kerry just said, but you may still transmit it. So please go along and actually be tested. And finally, I just want to say that the main venues that we have in the eastern suburb area are the St Vincent's Hospital COVID Clinic, the Prince of Wales Hospital Clinic, but there of course are also opportunities to be tested. Many people in that area would know Bondi Beach, Bondi and Rose Bay, We'll also be establishing a couple of pop-up venues this afternoon. I'll make some announcement or put out some statements on that later this afternoon once we've managed to establish a location for that. We've said time and time again, the world is a very dangerous place. Well, in this case, the eastern suburbs may or may not be. So people in those eastern suburbs particularly should be listening to the messages and getting tested for them, for their family and for their community.
Was he symptomatic? What led him to be tested?
Yes, he was symptomatic and he undertook testing, and again, thank you very much for taking those actions. It's assisted us in detecting this case.
An infectious period seems to be, what, from the 30th of April onwards?
So at the moment, he underwent testing on Tuesday, but I've had some advice that he has considered to be an infectious since Friday, the 30th of April.
Was he vaccinated, Dr. Jim?
No, he wasn't, but I'll have to confirm that.
Do you have any sense of any sort of working hypothesis of how he could have got this in terms of who he's been or where he's...
Unfortunately, not at this stage. Obviously, we've asked him about he hasn't returned from overseas. He hasn't worked in border or quarantine roles. He has not had any contact with the hospital system. So all of the usual routes where we would expect someone to have acquired the infection are not clear, and that's why this is really requires us to do that genome sequencing to give us that understanding of where that source of infection was, and then we can work back from that. In addition, we will be testing those around him, and so again that may lead us to some other chains of transmission. So we will be following up our usual detective work. The genome sequencing will be a key part of it, but it also will be the cooperation of his family and close contacts in coming forward for testing that will help us identify upstream paths where he could have acquired the infection.
Had the man travelled domestically? The Premier said that there would be genome testing in relation to strains in quarantine, but also in other states.
So this gentleman has not travelled, but obviously we have to keep our mind open about the transmission chains. We know that we've had cases in the community in other states and also we have the ongoing threat associated with incursions through our borders. So it was just a simple statement that we will look at when the genome sequencing comes back. The question to the specialist will be which strain has this person got and which strain does it match.
How many contacts does he have?
He has a reasonable number of close contacts, and then obviously there will be those venue contacts, which we're going through the process of identifying whether they will be close contact venues.
What's the reasonable number? Is that like a dozen?
At the moment, they're following up, a 20s of close contacts, but obviously some of these venues may be assessed as close contact venues, and so I don't have in front of me at the moment the capacity of the restaurant or how that's being classified. Obviously we go through that risk assessment process. We look at where the gentleman was seated and those other factors in terms of understanding close and casual contacts. So the CT values on this case indicate were low. So just to be clear, low CT values mean that you have a higher viral load and therefore potentially more infectious. So they do give us some cause for concern, but also the fact that sometimes the next ring of testing around this case will actually tell us whether he's passed it on. But also in this case, we're really interested in how this person acquired the infection to understand the broader risk in the community. And that's why we're asking people that have symptoms compatible with COVID to redouble your efforts and come out and get tested.
Regarding the cinema, could you just clarify that, are you appealing to everybody who's in the cinema to get tested or just the courier viewers? So
anyone in that courier theatre, we would suggest that you get tested, and anyone else, if you've got any symptoms at all, please get tested, but follow the public health advice, because obviously he's going to be re-interviewed about his movements, and it may be that he just went directly into that cinema to see the movie and did not do anything else, and that will change our risk assessment. So anyone who's been present there, please, if you've got any symptoms at all, please get tested. But if you're actually in that theatre or watching that film, please at this point isolate and take that action of get tested.
You mentioned that 100. Sorry, the 100 QR codes. Is there a fear there might have been 500 in the complex or
Look,
greater?
this is very preliminary information. I suppose what I highlighted for is the fact that having those QR codes available to us means that we can text people almost immediately. And so we know that there were 100 sign-ins. Now we need to go back to the management and understand, was that expected numbers? But I'm also conscious that it was a Friday night, and there may well have been other people that may have not QR coded. So that's why I'm suggesting that we all work with each other. If you do know someone has gone to that theatre, saw that movie, please just alert them to this alert.
Premier, how disappointing is it? How disappointing is it that, you know, you've been saying for almost a year now that we need to use these QR check-ins, and businesses still aren't forcing their customers to use it?
Look, as Dr. Chant said, it's very, very early hours. It's very preliminary in the information we have. But what we do know is the person who was diagnosed as positive did absolutely the right thing. And I want to thank him for being so fussy and making sure that he was checking in everywhere that he went. And that's given us a good source of information. And obviously Health have already sat down with him and now sitting down with him again to remember everything that he did in the last little while, certainly since the 30th of April. So the strong message is QR codes work. We need them to keep us safe. And this is a good wake-up call. We can never be complacent. I mean, I still try and do the elbow tap, but I've noticed around New South Wales, people are shaking hands and kissing in public. We just need to be aware that the virus is still around. Whilst we're in a pandemic, we still have to maintain that level of caution. And I just hope that everybody takes this as a wake-up call to make sure that all of us adjust our behaviour. It's really easy to let down your guard, especially in a social setting. So it's really important for us not to let down our guard, make sure we do QR codes. But also I want to thank Service New South Wales and also the police, because in recent weeks we did ask them to step up on compliance. So there has been a 30% increase in compliance of venues, not only to make sure that venues are displaying the QR code, but that it be at the front of house so that people are reminded, because it's easy to get distracted when you go to a venue. So we're making sure that all businesses, all establishments know how important it is to remind people, because it's easy to forget, easy to go about your business and be reminded later. But it's so important for us to maintain those basic rules that Health has been giving us advice on from day one. Get tested, good hand sanitisation, social distancing, and make sure that you use QR codes whenever you go to a venue.
Premier, presuming this ban, can I just clarify something, just about the timeline of events and where this gentleman went on the weekend? It appears he was going out and bought a barbecue, potentially went to a meat store, bought meat. Did he host a barbecue on the weekend with a number of people there? When you say close contacts in the 20s, I'm wondering how many people were at this person's
Look, when I'm saying close contacts in the 20s, I'm aware that they're following up clearly household contacts and other those close contacts that you have. So I'm not referring to any function or party. I'm not in a position, haven't been provided with that advice. What we're talking about is that there is obviously anyone has a number of people that they interact with. It's that close network of friends, and then we're providing the venue updates when they become available.
So we don't know specifically whether this person hosted an event while infectious?
I'm not aware of anything of that nature. So I think it's appropriate that we really do not speculate. I'm giving you the most up-to-date information on what I have available. I'm highlighting that his close friends and colleagues are being contacted if they've been exposed to him whilst infectious, and they are asked to be tested and to remain in isolation for that full 14 days. We are then identifying venues and working through that usual process, but it really is important that we don't speculate. And can I thank this gentleman for both using QR codes and also for getting a test.
And what people have checked in at those venues, sorry, just to clarify, have those text messages already gone out to people?
So they're in the process of going out, so they're just being collated. This information is just come to hand, so as soon as possible we'll get that information out to the individuals. And we use, as our routine, we also check if there's any other systems at the premises. So it may be that this does reflect the full amount of individuals at a venue. It's again important not to speculate. I think we're just highlighting the value that the QR codes have, and this is a salient reminder that the danger is ever present, and it's really important that we do those functions of checking in.
Just on the locations idea, and apologies if I missed that. Premier said southeast, and then you said, or in east, and then you said southeast. Can we get a bit more clarification about that?
Okay, so we divide. Sorry, that's my fault. We divide health districts, and so my mind works in health districts, whereas everyone else works in geographical areas. So it's eastern suburbs.
Yeah. In the eastern suburbs. Yeah.
Just clarification as well. You said he may have been highly contagious on Friday. Was he in his workplace?
So we understand that the infectious period is up to that 30th. And the advice I had, and obviously we reconfirm this, is that he hadn't been in his office on whilst infectious.
Premier, can we ask you, does this change anything with current restriction rules at all? Do you now have to review anything?
Well, look, this is very early, and no doubt I'll expect other cases. If there is one case and we don't have an immediate source, if there's no direct connection that we can establish, we have to assume there are other cases. That's why all of us need to be on guard, and our response will be proportionate, as always has in New South Wales. So we'll assess the situation. Obviously, we expect a high number of people to come forward to get testing. In the last 24 hours, we had 13,500 people come forward and get tested. No doubt this positive case in that part of Sydney with the venues that have been identified will alert more people to come forward and get tested, and that's a good thing. But our response will be proportionate to the number of cases that are established, the geographic location of the cases, and whether or not they're in isolation. So this is only a couple of hours into us being aware of what's going on, and our response will match obviously what we find out in the next few hours and in the next few days.
Is it frustrating? This will affect the bubble with New Zealand?
Well, I hope not. New Zealand had more cases and we didn't even flinch. So we are going to get more cases during a pandemic. We have to be very aware of that. And New South Wales always has the highest risk given the number of people coming in through overseas and the fact that our borders are open. So we always have to be aware that this risk is amongst us. And as I travel around the state, it's very interesting. Different parts of the state are more complacent than others. But when there is a case and we don't know the source, all of us have to be on guard no matter where you live, because it could have been someone who came in from a different state, a different city, or we just don't know yet. So therefore all options are on the table. We can't speculate, it's way too early. But it also means, unfortunately, we can't rule anything out. So everybody in the state needs to be on high alert. Anybody anywhere with the mildest of symptoms needs to come forward and get tested. And certainly if you've been in those venues at those times and you have the mildest of symptoms, come forward and get tested or follow the health advice. During the day, Dr. Chan has already announced a number of venues where this person was at. But during the day, health might revise its update from saying a casual contact to a close contact. And if you're a close contact, you have to get tested and stay home and get isolated. So obviously it's really important for people to follow the health advice, newsouthwales.gov.au or New South Wales Health, and make sure that that information is at your fingertips, or that you're aware of what's going on so that you can act appropriately. Because the more people that come forward and get tested, the more quickly we get on top of this current outbreak, the less we'll have to respond in a milder way than otherwise anticipated.
This man was in his mid-50s or in his 50s. People over the age of 50 in the phase 2A of the vaccine rollout are now eligible for an AstraZeneca shot, but phase 2A general public can't get an AstraZeneca shot in the New South Wales health vaccine system yet. They can in Victoria. Does this case change your mind at all on the May 24 opening date that New South Wales health clinics to start booking for general public in phase 2A that want an AstraZeneca shot?
Well, look, we know that there's nearly 3 million people in New South Wales over the age of 50, so there's no way we would have vaccinated 3 million people by now. which is the message. But as Dr. Chant said, even if you have been vaccinated, as I have, it doesn't mean you can't get it, and it doesn't mean you can't pass it on. Obviously, the chances of those two events are massively reduced when you have the vaccine, and obviously severe disease is prevented. But we have to be aware that under the current circumstances, when the vast majority of the population isn't vaccinated, all of us have to comply with existing processes in relation to health. And we also have to be aware that irrespective of whether we've been vaccinated or not, we have to take these precautions, and that is really critical. The other issue that I want to stress at this point in time is that we know the task ahead of us in New South Wales, and I can't urge enough how important it is for people to get vaccinated. On Monday, the mass vaccination hub in Homebush complements already the 5 major hubs we have, plus the 100 sites we have around the state. The GP network from the following Monday will take people over the age of 50. We encourage everyone to come forward and get tested. If you have any issues, you can talk to your GP about that. And obviously from the following week, everybody over 50 will also be able to go through the New South Wales health system. But please note that we still have people who work in areas where they have contact with hundreds of people every day that have to have the vaccine. As you can appreciate, school teachers, bus drivers, we're really keen in New South Wales to get people who've got contact with lots of people to get vaccinated first before we open up to all categories. And I appreciate New South Wales has always done things differently during COVID. We don't apologise for that, because we want to make sure we reduce the risk of major community transmission of major seeding events. And that's why it's really important to us to make sure that we've vaccinated all those categories of people that have a lot of contact with others who unintentionally, if they did have the virus, would spread it to a lot of people.
What phase are school teachers and bus drivers in the vaccine role? We haven't heard the specific phase.
No, I'm just suggesting that when...
But will you vaccinate them before phase 2A? Are you vaccinating them now? We haven't heard this.
Well, all I'll say is we are absolutely committed to vaccinating as many people as possible as soon as possible, and New South Wales Health is in the process of contacting cohorts of people to come forward and get vaccinated. Well, we ask everybody to await to be contacted directly from Health, and obviously from next Monday we'll be able to pretty much double our capacity in New South Wales. So at the moment we have capacity to do around 30,000 jabs a week. That's so long as the doses arrive. We can do around 30,000 jabs a week. From Monday we'll be able to do around 60,000. That obviously ups our ante, but also remember our GPs have already done more than 500,000 jabs in New South Wales, so the GP network, or nearly 500,000 jabs, the GP network is going very well as well. Even though there are challenges there, the GPs are getting jabs into arms, and the GP network plus the New South Wales health system together, we've seen more than 700,000 jabs already, and I'm keen to see that number go up.
Premier, just on the strain of this for the Premier or Dr. Chant, do we know what strain this is?
Not yet, and as Dr. Chant said, she expects to know in the early hours of the morning as to where it is, whether it's a quarantine, whether it matches anything we have in quarantine, whether it matches anything that was in other states, whether it matches any other case that's been positive in New South Wales, or in fact overseas. Yeah.
Premier, have you moved to remove Matthew Mason-Cox from the Liberal Party?
Yes, I understand that by the end of the day he will be formally expelled from the Liberal Party.
Why?
I'm sorry?
Why?
Because there is party discipline and party rules people have to follow. He clearly breached those, and it's actually the New South Wales Liberal Party, the organisation, that's taking the action.
Does that not need a vote of the state executive, Premier?
I'm sorry?
Does that not need a vote?
Not necessarily.
Or are they just going to ratify something that you've recommended to Chris?
Well, I would prefer Chris Stone answer that question, but I've been advised that by the end of the day.
So have you asked them to do it? Or
Yep.
Premier, what did you make of last night with Natasha McLaren-Jones?
Oh, look, I just find it very disappointing. Here we are in the middle of a pandemic, and here we have the Labor Party and the Greens supporting the Labor Party and the Greens supporting a Liberal male ahead of a Liberal female. I just don't get it.
Are you going to promote now?
I'm sorry?
What do you think the New South Wales people would have made of a shambles last night?
I think, as I was, they'd just wonder why Labor and the Greens thought it was okay to support a Liberal male over a Liberal female. But anyway, I don't think most people in New South Wales know or care about it, to be honest. And they don't care. They just want us to get on with the job of governing. That's my job, and I'm just not happy that that people obviously play games during what is a very difficult time in New South Wales.
Now that there's that Natasha McLaren-Jones will not be president, you have a cabinet vacancy. Are you going to promote her?
Today I've been worried about this, so I've not really turned my eye to it.
Last questions, please. Eligible to be or should be promoted into the Legislative Council presidency.
I've not thought of. I've not considered those issues. I know what my priorities are in New South Wales, and I'll continue to lead the state to keep our community safe.
Will you consider that?
Oh, that's for me to worry about.
That cabinet vacancy has been, that's been full for weeks. So are you not going to fill it?
No, that's for me to consider in good time. My priority is to keep the community safe and to make sure that our strong and stable government is supporting the people when they need us the most.
You mentioned the community doesn't care, and we saw what happened with Mr Latham's efforts late last year. Is it time to have actually a real debate in New South Wales politics about having an upper house?
Oh look, I'm happy I'm happy for people to have that conversation, but I also think it's important that sometimes people need to appeal to the greater good and just consider what our state is going through, what the community is going through, and really get your priorities right. I still don't understand, maybe some of you will ask them, why the Labor Party and the Greens would support a Liberal male over a Liberal female when it was still the same party. I don't get that. That's a matter for them. But having said that, that's something most of the people in the state don't care about. What people in New South Wales care about is keeping themselves and their families safe, and that's my job.
Well, just on that vein, then, will you support a Liberal male into cabinet over a Liberal female? Look,
I don't want to get into the speculative issues. To be honest, from the minute I woke up this morning, we've been dealing with, and I've got two witnesses here on very, very massive health issues all morning, and that's what's taken up all my time.
In comparison to what you've just declared as a Labor and Green fault, though, are you happy to say now that the next person promoted to cabinet will be?
No, I'm not happy to comment on anything which isn't my priority. My priority today is keeping the community safe.
Thanks, everyone. Appoint a woman to the parliamentary secretary position vacated by Michael Johnson when he resigned from Parliament.
As I said, my priority today is to keep the community safe, and that's what I've been focusing my attention on. Thank you.
Sorry, can I just add this, that in addition to those hospitals and sites that I mentioned earlier, I've just received, as the Premier said, we literally had this information for an hour and a half, now going, I suppose, on 2 hours. So the health system is quickly moving outside what we're doing here to get ready for people to be tested. And I want to add that in addition to those venues that I said earlier, there's also, if you happen to be travelling down there, the St George Hospital, Cogra, Sydney Eye Hospital, the Hurstville Community Centre, Sutherland Hospital, but also there's a pop-up, which I said earlier I would tell you as soon as I was advised, and I have just been advised, the local health district, the South Eastern Local Health District, dealing with the issue in the eastern suburbs, will be at Albion Centre, 150 Albion Street, Surrey Hills. It'll be operational from 4 o'clock this afternoon. Thank you very much.
Everyone.
Thank you.